Post-exposure prophylaxis in hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause severe liver damage. Post-exposure prophylaxis, PEP, is a preventive treatment given after exposure to the hepatitis B virus to prevent infection. Dosage and duration of treatment may vary depending on the individual case and should be determined by a healthcare provider based on the specific circumstances. Indications. PEP treatment is indicated in the following situations: sexual exposure to someone with acute or chronic hepatitis B infection, exposure to blood or body fluids of a person with hepatitis B infection, needlestick injury or other sharps-related exposure to hepatitis B contaminated instruments, perinatal exposure to hepatitis B infected mother. 2. Drugs used in PEP. The following drugs are used in PEP for hepatitis B: hepatitis B immune globulin, HBIG, hepatitis B vaccine, antiviral medications, if deemed necessary by a healthcare provider. 3. Dosage for HBIG. The dosage of HBIG varies and depends on the individual case. A healthcare provider will determine the appropriate dose based on the exposure type, timing, and other factors. For adults, 0.06 ml per kilogram or 1 ml for every 15 kilograms of body weight. For infants born to HBV-infected mothers, 0.5 ml within 12 hours of birth. 4. Dosage for hepatitis B vaccine. PEP for hepatitis B requires a series of hepatitis B vaccinations, which should be administered as soon as possible after exposure. Adults, 3 doses of 20 mcg each, given at 0, 1, and 6 months after initial dose. Infants, 3 doses of 10 mcg each, given at 0, 1, and 6 months after initial dose. 5. Antiviral medications. Antiviral medications are not always necessary for PEP in hepatitis B, but may be given in certain situations as determined by a healthcare provider. Tenofovir, 300 mg once daily for 28 days. Entecavir, 1 mg once daily for 28 days. Adefovir, 10 mg once daily for 28 days. In conclusion, post-exposure prophylaxis for hepatitis B involves the use of hepatitis B immune globulin and hepatitis B vaccine, with antiviral medications added in some cases. The dosage and duration of treatment may vary based on individual cases and should be determined by a healthcare provider.